and they helped us in a lot of different ways. We also wanted to engage the local media, and we have a tribal newspaper that comes out monthly. And we had a very close relationship with them, and they actually allowed us to have one page in the newspaper, a community health page designated to our work and articles about our work. So this really helped us get the message out about the benefits of smoke-free housing and really engage all of our tribal members in our efforts. The Michigan Department of Community Health kind of jumped on board later on in the project, and they came to us with some financial resources. We did have a grant, as Seth mentioned, the Strategic Alliance for Health grant funding, but sometimes, you know, with grants, there isn't a lot of money for extras, and so we didn't have money for a media campaign. So they actually came to us and liked the work we were doing and said, you know, we have a little bit of money, would you like to use it for a media campaign? And we were like, yes, great. So those ended up being our strong key partners. The stakeholders, we tried to identify, okay, who do we need to engage and get on board with this effort and get them interested in smoke-free housing. And of course, the number one stakeholder is the tenants themselves. And so we had them also assist us with some education and advocacy to demonstrate to the Housing Authority and the Housing Commission that there was a demand and a need for smoke-free housing. The Sioux Tribe Housing Commission Board, we made several presentations to them to move our project forward and to get them to help us with adoption of the policy and then to actually designate units smoke-free. And we didn't think we needed such strong support from the Sioux Tribe Board of Directors, but we really found that we really did, because our Sioux Tribe Housing Commission Board, even though they could actually adopt the policy and designate the units smoke-free, they themselves wanted approval from the Board of Directors. So it was important for us to get the Board of Directors supportive of smoke-free housing as well. So the first thing we did after we got our partners, identified our stakeholders, got our coalition together, we wanted to gather some data and background information. And at the time, with the Strategic Alliance for Health project, the CDC had developed a tool for assessing policy system and environmental status in our communities, and that was called the Change Tool Assessment. Some of you may be familiar with that. So we actually met with Sioux Tribe Housing Authority staff and completed the Change Tool Assessment with them. We also did some education with the tenants, and as you saw before, we had a little packets that said children need smoke-free air, and these were developed quite a few years ago, but we decided to use those packets and stuff them with information about smoke-free housing, and Youth Education and Activity Council students helped us with that. And we also decided we needed to survey the tenants to find out, are they in favor of smoke-free housing? How much support do we have from the tenants? So in December of 2008, we did housing surveys, and these are the results. We asked several questions. We tried to make it pretty simple and quick and easy. And we just wanted to know, did they think secondhand smoke was a health hazard? And of course, they did. And did they feel it was harmful to their children's health? The same amount, 98% said yes. The question that was key was, if available, would you prefer to live in a smoke-free building? And that was encouraging because 70% of the tenants said they would prefer to live in a smoke-free building. And if you look, skip another question and look at the question, do you or anyone you live with smoke, you can see that 44% of the tenants either smoked or lived with someone who smoked. So it just shows that even some of the people who smoked would prefer to live in a smoke-free building. So that was really quite encouraging, and we felt we had strong support. We had not very many people said the cigarettes from apartments entered their apartment and bothered them, but that was because we did survey all Sioux Tribe housing, and a lot of the Sioux Tribe housing is single-family dwellings, so that question was kind of a little skewed. And then we wanted to know, did they know that smoke-free apartment policies are legal, and 64% did. From the change assessment, we did the tobacco use module, and it generated a lot of discussion with the Sioux Tribe Housing Authority concerning the question, does your agency have a 24/7 tobacco-free policy? And the discussion that was brought up was that, yeah, within the buildings themselves where the staff from housing worked, they were all smoke-free. So they worked in a completely smoke-free environment. And so this kind of made them think, well, yeah, we are protected when we're at work, we're in smoke-free buildings, but the residents themselves don't have that same protection. So after we did our assessment, we decided, okay, let's create an action plan so that we know where we're going and how we're going to get there. So we developed this as a guide. We wanted to make sure that this guide was flexible, and it did change along the way. As you know, nothing goes completely according to plan. But we did try to put in some measurable objectives and a timeline that just kept us moving forward towards our goal. And this action plan was a comprehensive result of many lessons that we had already learned in other policy development efforts. So then we worked on, once we had our action plan, we knew where we were going, we needed to demonstrate our need and build on support. So in January then of 2009, we set up a meeting with Sioux Tribe housing staff to discuss the results of the tenant survey. And at that time, we delivered an educational packet, and we had a model smoke-free housing policy. We had a model smoke-free lease addendum. We had the actual Sault Ste. Marie Housing Commission policy that they had adopted a couple years earlier. We had a sample letter for tenants and some other materials from the Smoke-Free Environmental Law Project that were very good fact sheets. Is there a market for smoke-free housing? And they had done an article in Units, which is a housing trade magazine, and they had published an article, Clearing the Air, that gave a lot of good information. So we delivered that packet to the housing staff along with our discussion of the tenant survey, and we wanted to ask housing, is it okay to disseminate the results of that survey? They said it was, so we moved forward then in February with a presentation to the Housing Board of Commissioners, and we were asking then for a proposal to make some of the Sioux Tribe housing buildings smoke-free. We were hoping to get all of the multi-unit housing smoke-free. We were also hoping to get a percentage of the single-family dwellings smoke-free. We thought it would be an easier sell, but it turned out not to be. There was some opposition to this and a lot of discussion. So the Housing Authority Commissioners, they decided that they would prefer to survey each tenant individually. Even though we had gotten some aggregate results from our surveys, they wanted the housing resident specialist to meet with tenants individually to determine if they wanted their specific building to be designated smoke-free, and they wanted it to be a voluntary decision. So this led to then a conference call with the Smoke-Free Environmental Law Project Coordinator, Jim Bergman, to determine these interview process and to develop some talking points that the housing resident specialists could use when they were interviewing the residents. We did publish the results of our housing surveys in February in our tribal newspaper. Then we had kind of a great thing happen. The HUD memo came out in July of 2009, and this memo went to all public housing and Indian housing, and the subject was non-smoking policies in public housing, and the notice strongly encouraged public housing authorities to implement non-smoking policies in some or all of their public housing units. So we had some extra support from the U.S. Department of Housing and Urban Development on our side. So this really helped in our efforts and gave us a little more credibility. And we also published an article about that. We always tried to build support through connecting with some health observances. So in November, when the Great American Smokeout is held, we made a theme of the smoke-free housing with smoke-free places, healthy spaces, smiling faces, and we really promoted smoke-free housing during the Great American Smokeout. And right after that, we brought Jim Bergman up to Sault Ste. Marie and another community kind of on the western end of our 7-county service area in Manistee. He gave 2 presentations on smoke-free housing, and we invited landlords, apartment managers, owners, realtors, housing commission officials. And it generated a lot of discussion, and we had in the Sioux, someone from the Sioux Housing Commission did come and talked about the success of their smoke-free policies. So that really helped when we had a few people that had already done it that could talk to people that were thinking about going smoke-free and saying, yeah, we didn't have any problems, this has been great. So that was a really great step in moving us forward with that. We also published articles about Jim Bergman's visit. This is an article from our Sault Ste. Marie Evening News. So then the Housing Commission seemed ready to move forward. So we had Jim Bergman develop some draft policies for tribal housing, and they were sent to the Sioux Tribe Housing Director for review, and that was in March of 2010. Ended up, the Assistant Housing Director drafted a final policy on her own. She took some pieces from Jim's policy, but she did a lot on her own, and it was really great how she did it. She did a blanket policy for the whole Sioux Tribe housing. So it was one resolution saying that Sioux Tribe housing was going smoke-free with designated units. So then there was a second resolution designating the units that they wanted to be smoke-free, and that left it open for in the future for more units to go smoke-free without drafting an entire new policy. This is just the first part of their smoke-free housing policy, and you can find the full policy, I believe, is on the National Native, the Keep It Sacred website. And then this is the resolution. So they adopted the policy first, and then they passed a resolution which designated 3 triplexes that were planned for construction in the following year, and they were for elders. They would actually open smoke-free from the very beginning. And then they designated 4 duplexes located in the community of Kinchlow as smoke-free. They also, which I thought was great, they do have an application that tribal members fill out to actually get a home. And they put a question on there that says, would you prefer smoke-free housing? So this was a way to gain more support in the future for designating more units smoke-free, if we could prove there was a demand. So we like that they did add that to their request for housing assistance. So as I said, the policy passed in April 2010, and then the resolution designating the smoke-free units passed in May 2010. And we had a lot of publicity. This family that you see in the picture is our poster family. We can use them on our brochures and in our press releases. And they are two of the families that share a duplex. And they were just very excited to be able to be in a smoke-free environment. We decided we wanted to celebrate the fact that the Housing Commission passed this policy, so we did a recognition event. We also developed some signage that the residents could put out in their yard, and window clings they could put on their windows so visitors would know that their unit was smoke-free. We also provided a lot of marketing of our nicotine dependence program, so people would have some opportunities to quit smoking if they wanted. We did a lot of media and education, and we started to draft a plan to evaluate the success of the policy. And like I said, with the media campaign, the Michigan Department of Community Health actually partnered with us, and their funding allowed us to do the signage. We did radio ads, TV ads. We developed a third-hand smoke brochure and got that printed. We did landlord tenant tips and table tents, and we redid the tenant surveys. So all this funding really helped increase our ability to move our initiative forward. And this was the invitation that we sent out. We really tried to make this a nice celebration. We invited all of our tribal board members, the media. We had our local TV station came up for the event. And we had just a lot of people. As you can see, there was quite a group of people, and we presented a nice certificate then to the Housing Commission board, and 4 of them there on the bottom are posing with their certificate. This is the signage. We had a person who coordinated the youth education and activities design the logo for our smoke-free homes. These are brochures we distributed to promote our Sioux Tribe Nicotine Dependence Program. And then this is our brochure we did on third-hand smoke. It does include second-hand smoke, but we really wanted to emphasize the dangers of third-hand smoke, since so many of the tribal housing units are single-family dwellings. We really wanted to move forward the case for making some of those single-family unit dwellings smoke-free to take away the dangers of the third-hand smoke. And we had seen, I had read a lot of research papers, but there really was nothing out there that was a reader-friendly brochure that talked about third-hand smoke. So we decided we would go ahead and develop our own. Afterwards, this was in October, then we invited Jim Bergman back up again for kind of a follow-up reception to talk about smoke-free housing. We invited a lot of the same people who came to his first presentations to come up, and we invited Sioux Tribe Housing to talk about their success, and we had the tribal newspaper person do an article for us, and it aired not only in the tribal paper but in our local Sault Ste. Marie paper. These are the tenant and landlord flyers that we developed, and these were made into table tents as well. And we distributed these table tents to all of our tribal health centers, to local physicians' offices. They have them at all the housing offices. Wherever we could get people to put them, we distributed these landlords and tenants. We especially wanted tenants to know that they could ask for smoke-free housing. We did some paid media. We did a third-hand smoke radio ad, and this was recorded by youth education and activities students, and it aired across our 7-county service area. And we also did a TV ad on creating awareness of the dangers of third-hand smoke. We decided we would redo the smoke-free housing tenant surveys. So in January 2011, we sent out another short survey. It was mailed to all 480 Sioux Tribe housing units. We did provide incentives for returning the surveys. So if they returned the survey, they would be in a drawing for some gift cards. And we had a little tear-off tab so that the surveys would remain anonymous. And we collected 138 responses for a response rate of almost 30%, which we thought was quite good. The first survey, our response rate was 25%. And then Michigan Public Health Institute were our evaluators, and they actually analyzed the data from the second round of surveys for us. So what we found was 48% of survey respondents reported smoking every day or some days. So it was a little higher, but that's including, you know, the 37% said they smoke every day, so that's lower than the 44% from the first survey, but the 48.6 was a little bit higher. So we don't know if we had more people that smoked actually returning the survey this time. And it might have been because we did create a lot of awareness with designating units smoke-free. We asked the respondents again, would they prefer to live in a smoke-free home or building? And this was a little disappointing because it went down from 70% to 50% from the first survey. So that kind of made us think that since we had created a lot of awareness around smoke-free housing, we got more of the people who felt that they wanted to be able to smoke in their home actually returning the survey. But on the other hand, we were encouraged because among the respondents who reported that they do smoke every day, 14.3% of those did say they would prefer to live in a smoke-free home. So this was good data to have. Some of the anecdotal comments that we got from the surveys were, I do wish sites could all be smoke-free. My son has asthma, and it's hard on him to be subjected to secondhand smoke. One person said, if you want to smoke, go outside, especially for your children's sake. So we did get some good comments. We got some bad comments too, but you know, some comments that said I should be able to smoke in my home if I want. But we felt that we had more positive comments than negative. From there, we also decided we would talk to the Sioux Tribe Housing Commission about the playgrounds. Every one of our housing sites does have a playground. And so we said, well, you know, would you like to have your playgrounds tobacco-free? And they were like, yes, we really think that would be great. You know, we'd keep moving forward with changing the social norms around tobacco use. So on April 18th of 2011, the Housing Commission did pass a resolution which made all of the playgrounds at all housing sites tobacco-free. And so we had some signage made for them. They helped us, and this is at the recognition event. We were all of our partners posing at the playground with the sign in place. Then we also had a banner made. As I said, the 3 triplexes that were designated smoke-free were going to be constructed. So during construction, we had this big banner that really announced that these units would be opening, and when they opened, they would be smoke-free. So in August 2011, the Sioux Tribe Housing Commission Board designated another duplex smoke-free. So we had a total of 5 duplexes that smoke-free in August 2011, and just last week, the Housing Commission designated 1 more duplex smoke-free. So we are ongoing one by one. It's a slow process. The housing resident specialist did kind of tell me she really has targeted certain units, and when people move out that she knows smoke, she has in her mind to ask for those units to be smoke-free. And her next one, there is a single-family unit that will be vacated this summer, and she wants that to be the first single-family unit to be designated smoke-free. They also have had such success with the elder triplexes. That's 9 units that opened smoke-free, and they were for elders, and they're going to build another elder complex in St. Ignace, which is another community in our service area, and those will be opening smoke-free. So I guess to summarize the key steps in policy change, you can see that it does take time. We started in November 2008, and it's still, our project is still ongoing. We still do run the smoke-free housing ads periodically. We ran 2 of those ads just after the Great American Smokeout this year. We always try to keep this on the forefront and keep the awareness going in the community and among housing residents. For our CDC Strategic Alliance for Health grant, they wanted us to write an implementation guide, so we wrote our implementation guide on facilitating adoption of a smoke-free housing policy for a tribal housing authority. So this guide is on our website. You can see our website at the bottom. It's healthyupcommunities.com. This is our logo. I do have to say that this website will only be up for a short time. We're in the process right now of revamping our website, and we have made a new URL will be up for health, upforhealth.com. But you can still go to the Healthy UP Communities, and once the new site is up, if you go to Healthy UP Communities, you'll be redirected. So you can still access this. I think our policy is still on there. Our third-hand smoke brochure, you can download copies of that on this website. A lot of information on the website. I guess that is all I have. Seth, were you taking questions?
Yes, I also wanted to mention that both the implementation guide and the actual policy are on Keep It Sacred under the Smoke-Free Toolkit, the Tribal Toolkit, as well as your brochure that you guys put together. All of
Oh,
those
good.
resources are downloadable at Keep It Sacred. And now we're going to have questions for Donna. So if you have a question, you can either raise your hand and then I can unmute you, and then you can ask her yourself, or you could do it where you type in the question for those people who probably don't have audio equipment, and I can then read it to her. So, questions for Donna. Hold on just a second. This question is from Warren Ortland. Does the Housing Commission have to pass a new resolution every time a new building goes smoke free?
Yes, they do, but it's not as difficult as rewriting the policy. It's just um, basically a formality of using the same resolution and just putting in the address of the new unit that will be smoke-free. So yeah, it's a little cumbersome, but at least it's better. It's kind of like the best we could do, because the board was not willing at the time when they adopted the first policy. They were not willing to make every unit smoke-free, so we kind of compromised and took this as the next best thing.
We also have another question from Kelly Millam. How many tribal members do you have, Donna, and how many housing units are currently under your tribal jurisdiction?
Well, we have about 38,000 tribal members, but we only have 13,000 that live within our service area, and that's where our housing units are. So we have, throughout our 7-county service area, we have 480 housing units. And like I said, most of those units are single-family dwellings.
Other questions for Donna? Okay, here's another one. What are some effective methods you suggested to get through to our housing board? Or, sorry, rather, what are some effective housing methods you can suggest to get through to the housing board?
Well, I think what really helped us was doing the tenant surveys first, so that we could show them that the tenants themselves actually did want smoke-free housing, because their perception basically was that most people smoke. We have very high rates of smoking among our tribal members. And so I think that our tribal board didn't think there was a lot of support for smoke-free housing. And I think having those tenant surveys where we had 70% preferred to live in a smoke-free building really surprised them. We also had support from, our tribal board, the tribal board, actual tribal board of directors, and our tribal attorney. I know we had, during one meeting, there was discussion, and one of the Housing Commission board members was kind of talking about smokers' rights and kind of comparing it to, the rights to own guns. I shouldn't even bring that up. But anyways, our tribal attorney kind of looked at him and said, well, if your gun were going off and shooting holes in people's walls, I think you'd do something about it. So, we really had a lot of good support, other than just us in community health saying we needed this. We needed to get other people engaged and show the board that there was support from everyone.
Okay, there's another question. With multi-unit housing, are designated smoking areas encouraged in your strategy?
No, they're not. And we tried to not designate areas. I mean, people can go outside their home. We didn't pinpoint any, and that's why we really wanted to make the playground smoke-free, because we didn't want a bunch of people going outside and walking around the playground where the kids were playing. So other than just designating the playgrounds tobacco-free, we didn't designate any other outdoor areas.
Other questions? How about how long did the whole process take from inception to completion?
Well, till we got the policy adopted, it was about a year and a half. But we still feel like we're still working on it until we get, I feel like until we get a certain, my goal is to have a certain percentage of even the single family dwellings be smoke free so that um, when a family moves in, they don't move into a house where smoking in there for years and still a lot of toxins.
Okay, I think Kim Alfred has something she wanted to say.
Yeah, this is Kim Alford, Donna. Thank you so much for your presentation. And Donna and I are colleagues from the Sioux Tribe, and I got the opportunity to work with Donna on some of the work that she's done. And she's an excellent resource if you have any questions for her. And the implementation guide that they put together is an excellent resource as well. So I just wanted to say thanks, Donna, and we really appreciate your presentation and the work that you're doing with Sioux Tribe.
Thank you, Kim.
Okay, are there other questions for Donna? Okay, hold on just a second. What do you see as your next steps?
So, our next steps, I think, are just to keep in close contact with Sioux Tribe Housing Authority, um, make sure that we're still gathering support for smoke-free housing from the tenants, looking at, we need to really sit down and look at those applications and see, are people really requesting smoke-free housing? We really would like to redo the survey again, the tenant surveys. We have that on our radar, and probably still keep the media campaign going. As far as enforcement issues, we really haven't had any problems. Nothing has come up. We haven't had any problems with complaints in the duplexes from, we thought maybe we would have complaints if visitors came and smoked in a smoke-free duplex, but that hasn't happened. So enforcement really has not been a problem. So I guess our next steps is just to keep working towards
Hello, Donna. Did we lose you? We may have lost Donna. Oh, maybe I lost Donna.
Can you hear me, Donna?
you, Kim. Can you hear me?
Yeah, I'm not sure if others can hear me. Certainly Seth can't hear any of us, so.
I can hear you now.
Oh.
You,
Oh, good.
Oh, okay.
all of a sudden it just went blank for a second, and I thought, oh no, what happened? But now I can hear everybody just fine.
Oh, good. Okay.
There was another question. After making the policies, what are some good ideas for what would be some key steps in enforcing afterwards? So, any ideas on that?
Well, we haven't had any issues. I guess there wasn't. enforcement in the policy. There is a protocol for enforcement, and like first the tenant would get a warning, a letter. There are 3 steps before we would actually, they would actually say a tenant would have to leave, and really I don't think that would ever happen. In fact, that was a big concern with our tribal board with even adopting this policy, because the goal of the tribe is to make sure that tribal members have affordable housing. So they didn't want to put up any barriers to people getting housing if they didn't want to live in a smoke-free or felt they couldn't abide by those rules. So that was a big issue, but we haven't had enforcement problems. I don't think they've even had a warning.
Another question
But
is,
it is
oh,
important. It is important to put your protocol in writing in the policy right at the very beginning.
would you allow elders to smoke in the building if they are disabled? Like, I guess, so they don't have to go outside, I guess is the question.
Not if they're in a smoke-free unit. And I think, again, that's why the tribal board members didn't want to designate all of the units. They wanted to leave some options open. But we wanted to keep the elders that want to be in a smoke-free unit smoke-free without grandfathering anyone in because of any disability or anything. So the elder complexes that are new, that have open smoke-free, are strictly for smoke-free.
What would be the procedure for elders? Is the next question.
You mean if they were disabled, or?
It does not say. It just says, what would be the procedure for elders?
Well, it would depend on if they're in the smoke-free building, they would have to go outside to smoke.
Do you do anything specific to keep your tribal elected leaders engaged in the initiative?
Yes, we do. We have with our grants, both the Strategic Alliance for Health and the Community Transformation Grant. We have a leadership team, and several of our tribal board members belong to that leadership team. We have quarterly meetings that keep them informed of our grant activities, and we ask for their input and direction when we're determining directions to go and objectives and activities to how to proceed. So yeah, we have a close relationship with our tribal board of directors.
Have you seen any increase in quit services since beginning the campaign?
Yes, we did. In fact, my colleague that shares an office with me does the nicotine dependence program and does a lot of cessation counseling. And she was just extremely, extremely busy. After these, as the more we work on this, it seems like she gets busier and busier, which is a good thing.
Can you talk a little about the makeup of your tribal governmental structure?
Well, we have a tribal chairperson and the tribal board of directors. They are all elected, and basically they pass most of the policies of the tribe. Now, the Housing Commission board of directors did have the ability to pass the policy themselves without going through the tribal board of directors, but most of the time when we are looking at policy change, it's through the full tribal board of directors.
What was the most troublesome aspect of the effort, and would you do anything differently? Or what would you do differently, rather?
Troublesome aspect. I think it was the disappointment initially when we um, first met with the Sioux Tribe Housing Authority staff. They were so supportive, and they kind of indicated to us that, oh, it will be very easy. We'll be able to get most of housing smoke free. And then when we actually sat down with the housing board and then we heard from the board of directors some of their concerns, that was tough. It disappointed us that they weren't going to just do the whole thing smoke free, but so we had to compromise, and that's always difficult, but you know, it's still, we didn't want it to stop us from doing anything. So, and we're still positive. We still want to move forward, and we still think that someday we will be able to get all of the multi-units smoke-free and a portion of the single unit smoke-free.
Another question is, where does the funding come from for the cessation resources in your policies?
Well, the tribe adds a charge when they sell tobacco. Um, they add like a state tax of their own. They don't charge the state tax, but we do charge a little extra. And Kim was very instrumental in getting that passed, that they take a portion of that money and that goes to our health education budget, and it pays for our nicotine dependence program and for the counselors, and the nicotine replacement therapy is free to tribal members and tribal employees that have insurance. And recently we just passed a resolution to the board so that all employees, whether they were tribal or had insurance, could actually access our program.
Do you have foster care homes under your tribal jurisdiction, and if so, how many?
That's a question I don't know. I can't answer. I'm not sure.
Okay. You stated that the youth were involved in the beginning of the process. How involved are they now?
They're still really maybe not as involved as in the beginning, but we can always call on them. Right now we're looking at doing another campaign. We're partnering with our Great Start Collaborative early child care providers, and they want to do a campaign about secondhand smoke and third-hand smoke for their parents and their staff, and we're going to have the youth help us stuff packets again, and so we do try to keep them engaged in a lot of our various projects.
Other questions? Do you have some youth experience in your background? Is that why you used them at first?
Yeah, I do. I've worked at several health departments on several different grant programs, and we had a drug-free community support program grant from SAMHSA, and we actually did a lot of youth alcohol, tobacco, and other drug preventions, and we actually spent weeks that we took some of our youth to camps in the summer for a week and did programming. So yeah, I've worked with youth for a long time.
Okay, we're almost out of time. Do be reminded we will send a brief evaluation by way of SurveyMonkey to the attendees in the near future. Please do let us know how we can improve our efforts. We would like to also thank you very much for attending this webinar. If there are any other questions, you can send them to keepitsacred.org. Also, a copy of this presentation, as well as a recording of the presentation itself, will be posted later this afternoon to keepitsacred.org. Please look for the post evaluation, which will come to you by email within the next few days. Your input is important and appreciated. And with that, we'd like to very much thank Donna, and thank you. Bye-bye.